And welcome back. Good afternoon. I'm Roger Watterson, and this is the Mannin Line. And this is part of the Sunday activity where you should be joining us. Quite simply, all you've got to do is telephone us. And the telephone number is 66 13 68. You can text us, of course, to 166177 or email to studio@manxradio.com. But we would like to talk to you. I mean, it is called a phone-in programme, so let's hear from you, please. 66 13 68. Now, this is the last programmes, Mannin Line, before Christmas, would you believe? So maybe you've got some Christmas messages you'd like to pass on to somebody, or like to tell us a little bit about what's going on. Whatever, Catherine Nicholl is at the other side of the telephone there, waiting for your calls. And with me in the studio, we have our guest from the earlier programme, Sunday Opinion, Dr. Henrietta Ewart. Now, in these days of public health, which I defined earlier on, was the science of art of preventing disease, prolonging life and promoting human health through organised efforts and informed choices of society, organisations, public and private, communities and individuals. And analysing the health of a population and threats is the basis of public health. And the recent report published by Dr. Henrietta Ewart as the Director of Public Health does just that. So we discussed in the earlier programme just some of the issues raised in the report, and we may get time to discuss some of the others, but perhaps with your contribution as well. 66 13 68 is the question. We talk about public health, Henrietta, but I was just saying to you before, Christmas is one of the things we didn't bring into our topic of conversation, which is a very difficult one to define, is the effects of loneliness.
Yes, there have been some interesting sort of modelling studies done around loneliness, which indicate that the effects of being lonely and socially isolated on your health are roughly equivalent to smoking 15 cigarettes a day. So yes, loneliness and social isolation does have an impact on your health and well-being, and that can be measured in terms of ill health and indeed premature mortality.
Yes, I was going to say, I know one or two funeral directors, and they tell me that from about now to about the second week in January is one of the busiest times of their year in it, which tell us something.
Yes, I mean, death rates are well known to rise across the winter months, and in fact there is a statistic that is calculated called the excess winter death rate. So we would always expect to see a slight rise in death rates across the winter. That is worse in very hard winters, better in milder winters, but it's a feature that can be seen in any winter.
Right, now, we've got all sorts of subjects today as well. Talking Heads this week was busy. We had people talking about the Ramsey shipyard and, of course, the inevitable discussion about Brexit and the Isle of Man, the meat plant and the plans there. And, of course, there's been a significant debate about abortion in different ways in the island. A drink and drive at Christmas and a skint Christmas too. I mean, the trouble with Christmas is it's expensive, isn't it? Cruise ships, are they a good thing or a bad thing? Well, we covered that on Sunday Opinion a couple of times in the past few months. The snow, dementia at Christmas, and something which I thought was an interesting subject. I'm not too sure how we handled it. Man flu is real. Whichever, anyway. If you'd like to talk about those or any other topic of your choice as well, then give Catherine a ring. She's sitting there looking at the screen, waiting for your call. 66 13 68. We'll take a break first. And welcome back to the Mannin Line. With me is Dr. Henrietta Ewart. She is the Chief Medical Officer. Chief Medical Officer. Get it right?
Director of Public Health.
Right. Yes. Henrietta, we've got quite a few texts and emails in, and I'll go to a caller in a second or two, but it says, as author of this report, did you say it makes grim reading when published? And did you water it down? Well, I don't remember you saying that, but there's a question there.
No, I don't remember saying it made grim reading. I would certainly have said that we have indicators that are cause for concern. Some indicators where we are actually significantly worse than the average for England. Some where we're the same or similar to England. And even those we need to stop and think about, because given our socioeconomic situation, we should be better than England. So if we're only looking the same, we need to think a bit more about those areas.
Now, I'm sorry I missed the name of your guest, David asks, But she mentioned about gastric band and weight loss. Will the gastric operations be restarting soon? As we were told, there was a breakdown in communications as to why they stopped. Do you know anything about that? That's probably not quite in your department, is it?
It's tangentially so. First of all, gastric banding is not an approach that would be used much these days because it didn't really work very well, and an awful lot of people either had complications or needed to progress to much more major surgery. So the lap band, gastric band, wouldn't be what would be organised for treating people with morbid obesity anymore. There were issues around the contract arrangements. Obviously, we can't do that surgery on island because it's far too specialist, and we wouldn't have the numbers coming through to support maintaining that expertise. So it's a service that we have to commission from specialist providers across, and there have been problems with the hospitals across in terms of hospitals pulling out of offering that service. So it's an issue that they're facing in England too. They haven't got enough providers of that specialist surgery, and we're, feeling the effect of that too.
Right, now we have our first caller on the line, which it's funny enough, I was only saying the other day we haven't heard from David for a while. I wonder how he's getting on, and welcome to David Quirk. Good afternoon, David.
Hi, Roger. Well, my friend Stu Peters, you see, is keeping me busy all week, but the weekends I try to relax if I can.
Right.
But can I say that the Director of Health, could she indicate, I want to push a few things out there first. Could she indicate where it is on the website so we can read the report? And I'm sorry I haven't read it. But I just wanted to ask her directly was, with reference to the number of children that do play sport on the Isle of Man. I'm connected with football, and we have 1,600 children in the junior league that play football right around the island. We had this morning, although the conditions were not that great, we had 50 kids playing under sixes this morning at Benehig. And can I just ask the Director of Health, and it's not a political one really, but it touches on the edge of it, is the benefit really of getting kids into sporting activities, whether that's football, hockey, swimming, even bowls. I mean, I bowl now I have done for a long time at the NFC. And for that generational group as well, even some youngsters there. I met a young fellow last week who was 70 years old and plays bowls indoor, and it's great for him. Can I just have a quick statement from her about that?
Yep, I think anything that gets people active is to be supported, and I think sport is a wonderful contribution to that. But I think I also have to say that sport isn't the only way that people can get active. And what, from a public health perspective, we really want to encourage is people to take up activities that form part of their daily routine and that they will do throughout life. So for those who want to do sports, that is absolutely wonderful, and I fully support all the things that are in place for that. But we have to accept that some people will never really do sport because it just doesn't float their boat. Others will do sport at certain parts of their life, and I would say I'm a prime example of that. I did a lot of sport in my youth. I don't do any now. What I do is walk, because I was brought up to walk. We only had one car in the family. My mum didn't drive, so if we wanted to get anywhere, we walked. I still walk to this day. So I think what I'm saying there is that sport is fantastic, and I think the opportunities for it are great and should be built on, but we mustn't forget that there are all sorts of other ways in which people can get the physical activity they need.
Yeah, and I agree with you on that. But a couple of questions to you is that thing. The serious concern would be is, and I don't know whether you do contact sporting organisations or the Isle of Man FA, Isle of Man Junior League, the Hockey Association, for their views on different things for the island for the future. The worry I see in the future is going to be costs. Now, the costs may be only £2 or £3 here, but when you're talking about a couple of hundred kids, the money starts to go up a little bit for the facilities. And if we don't have the facilities because we're in the Northern Hemisphere, we can't play them, and we can't keep those kids out of that obesity train. And the final thing, before I go to a political one, really is, were you consulted, was your division consulted on the removal of the Meals on Wheels? Because I think that's a real draconian measure that we're going to suffer in the space of 6 months.
I think there are various issues around the Meals on Wheels, and it doesn't sit within my division, so it's not really for me to comment on that.
Were you consulted on it, though?
I was involved as a director in the board discussions around that. I think there were issues about the quality of that service and the cost of it, which were of concern. It was not providing a good public health function as it was set up.
Okay, good answer, I suppose, but we'll need to find out a little bit more about
now,
that.
David, you've said you've got a political question now, which of course I can't ask Henrietta to answer, but maybe...
No, that's fine. I know that, and that's what I mentioned.
Yeah.
I want just take an opportunity. It's just sad, really. I want to make that point, really, is that Chris Thomas has got a motion down for the House of Keys to remove the MLCs from voting on who will be the Chief Minister. Mm-hmm. I think, Mr. Thomas, that's a really critical move not to do. And he needs to look at that. And I would say to members, and I've been there, I've had the T-shirt on it, those MLCs, and I've been there for 10 years, have different views. And when you want a balance within government, when it's what sometimes can be slightly thing to one side, if you would have looked at if a certain person would have got to be Chief Minister and she's not well at the minute, look at the boat we would have been in now and look at what the state of health is, and I'll leave it at that.
All right, David. Well, thank you for joining us, and I wish you well for Christmas.
Nice to hear you, and the same.
Right.
Keep well.
Cheers. Bye-bye. All right, that was David Quirk. Catherine says, Simon, but I've got it here in front of me. Will Roger be covering any political issues in 2018? Most certainly, Simon. I think this last year, of course, has been the honeymoon period with the new House of Keys, but there's lots of political issues, some of them quite serious, popping up now for 2018, and we'll be covering them as and when we can get to grips with them or it's appropriate, Simon. So don't worry, but some of the older Sunday opinion programmes are likely to return next year. And now what was, we've got 2 or 3 texts coming in. If people had more money, do you think they would eat more healthily, or would they simply eat more junk food?
That's a very interesting question, and one which I think is probably quite difficult to answer because a lot of it will depend on individual choice. However, what I can say is that we know very well that fruit and vegetables per 1,000 calories is actually more expensive than 1,000 calories of high fat, high sugar junk food. So there certainly is an issue. If you're on a limited income, it is easier to get lots of calories for your money from junk food than it is from buying fruit, vegetables, lean meat and so on. So that is an issue. Mm-hmm. But if you give more people more money, some will spend it on healthier foods, others will spend it on more junk food or on other things like smoking or alcohol or what have you.
It's a matter of taste as well. You know, the junk food's tasty. Cooking some of the other things you're talking about need to be cooked properly to make them tasty. And we come back to what we said before about last week. We discovered with the food bank that a significant number of people who got food from them didn't know how to cook it.
Yeah. I think that's true, and I think that's something that we need to think about, and perhaps schools and colleges have a place to play in that, in giving people the skills to do that cooking.
Sometimes the actual cause of death is not the underlying malaise, e.g. an old person with cancer dying of pneumonia in a hospital bed. Is this recorded properly?
It should be, because death certificates enable you to put several causes of death. You have the top cause of death, if you like. So in that example, it would be pneumonia that actually carried the person off. But underneath that on the death certificate would be the other things. So that might be carcinomatosis, that's spread cancer. And then underneath that, it might be, cancer of the stomach, because that was the thing that actually started the cancer. And then if the person had also perhaps had chronic heart disease, that could be put there as well. So we do get that full picture, not just the headline cause.
Right. Now, one of the topics which has popped up in Tynwald this last few days is the issue of air quality. which not absolutely too sure what the answer said, Tyrwell, except it's there's no statutory requirement to do certain things. But nevertheless, we live in a society which we like to think we're in a fairly clean air, really. And then over here, is air quality a public health issue?
Air quality is a public health issue, and as with all public health issues, one ought to be able to find out what the picture is locally. And at the minute here we can't, because although there was some air monitoring done here on a regular basis, it was done at a limited number of sites and it stopped, I think I'm right in saying, in 2009. Now, if we compare ourselves to other areas, and England's the obvious one, obviously there are some very well-known issues about air quality in England which are related to specific things. So, for example, central London has some of the worst air quality in the world, and that's related to vehicle congestion, diesel emissions within that, and so on. Other areas in England that are known to have a problem will be places near major motorway intersections, dual carriageways, perhaps near large industrial plants. Now, we don't have any of those features here, so we don't have any of those massive population level problems, but we may well have smaller but nonetheless significant problems. So as Director of Public Health, I cannot yet be assured that active travel, encouraging people to go to work by cycle or walking, won't give them an air quality problem if they have to walk through areas that are maybe only congested at certain times of day, but nonetheless are congested at those times of day and may be associated with reduced air quality. In the grand scope of things, that's maybe not a big issue, and being active in how you get to work would still give you health benefits even if you do get the odd blast of exhaust. But for some members of the population, that might be young children, particularly children with predisposition to asthma, an active travel to school, walking to school, if they're actually going to be exposed to exhaust fumes, maybe from other parents' cars who are just sitting there with the engines idling, that could be an issue for them. So I think we need to do some of that specific context modelling, maybe around schools and around major routes into work, to actually really understand what's going on here and whether we need to try and do something about it.
What about coal fires and wood burners?
Yes, those can certainly cause a problem, and we should be looking into it. Wood burners are a problem, and they're particularly a problem if you stick on your wood burner things like varnished or painted wood that you've got from building recycling, because you get all sorts of particulates that you wouldn't be expecting to get from there. So yes, any areas where that is a feature, we ought to be doing some monitoring.
I asked the question because members of my family have a property in the French Alps, and they're on a hillside, but the valleys around them now are seriously suffering from pollution. Right. Like, you don't think of the French Alps as a pollution area.
Don't.
Serious health and pollution problems, not cars, wood burners.
Yeah.
In the winter.
Yeah.
So they're asking people not to use them.
Yeah.
Right now, anecdotally, Clatterbridge Cancer Centre and the Liverpool Royal call the Isle of Man Cancer Island. Are you researching the incidence of cancer, blood cancers specifically? We seem to claim a greater percentage than elsewhere. Now, are we in a cluster, Sellafield, Chernobyl? Are we in the direct fallout zone?
Well, the first thing to say there is at the moment we have no recording system or system that has actually produced data on incidents. And that is a big gap. It's a gap that has been identified, and we now do have in place the system to record incidents of cancer. So that's people with new cases of cancer. Obviously, it's going to take a while for sufficient numbers to go through to actually get anything that we can use statistically.
But
okay.
There's been a fear about Sellafield since they opened at Windscale.
Exactly. And what I can say, obviously, the end point of this is deaths. Our death data does not indicate any raised levels of death from cancer compared to elsewhere.
Could that be better treatment, though?
Well, that's why we need the incident data. That's what we really need to understand. But at the minute, the death data does not give us any cause for concern.
OK, now, could you please ask Dr. Ewart where a member of the public can get a printed copy of the report, A Healthy Ireland?
You can ring the Public Health Department on 01624 642 639.
01624 642 639. Yes.
Yeah.
And or can they get it? Is it on a website as well?
It is on a website. It's on www.gov.im/public health.
Right.
And you'll find a link there.
Right. Okay. Right. So that's the report we've been talking about in full.
Yeah.
Good. There we are, Roger. That's where you can find it. Now, Nick says that my kids put on weight when on school meals. And those meals are provided by the Department of Health. We end up by giving them packed lunches. Health, is it, or educate? Anyway, we end up by giving them packed lunches to stop them getting fat.
Yeah. I empathise deeply with that. The current government catering service, which as I understand it currently provides hospital meals and school meals, and is, I have to say, cited within the Department of Health and Social Care, the nutritional standards of that offering are not what they should be, either in terms of the portion control or in terms of the quality of the content. And I think within the same financial envelope, much better nutrition could and should be provided. I have my own particular illustration of this, actually, which is the flapjack, which is sold in the hospital cafe. One of those standard flapjacks costs £1. It weighs 200 grams and it contains 800 calories. That is roughly half the calorie requirement for a normally active adult. Now, if you're just snacking on something like that, you won't even realise how many calories you're taking in. And if you eat your 3 normal meals on top of that, you're already into excess calories. And that is how the weight slips on.
By just snacking?
Largely. And failure of portion control, failure to appreciate what you're actually taking in. So you eat 800 calories for a flapjack and you maybe don't even remember that you ate it.
Right, good point there. 20% of families affected by alcohol, says Mick. This is obviously bunkum. Based on discredited revised UK limits which ignored heart benefits and used research which was secretly revised by the Public Health Executive because they didn't like the original conclusion. Now, I think there's 2 or 3 issues muddled together there, isn't it? 20% of the people, discredited information, and the benefits. He's got 3 together.
I think, was it Nick? I think he's misunderstanding the source of our statistic of 20% of families affected. That hasn't come from any UK report that has since been discredited. It came from our own lifestyle survey, which was sent out to households on the Isle of Man and was completed by them and sent back. And that's what people on the Isle of Man have told us, that 20% of them, their families are affected in some way by the drinking of one or more family members.
I think he's interpreted as 21% of people drinking heavily, but it wasn't 20 of families
it's
affected
families
by
affected.
the drinking.
Yeah.
Right. That's one of the points. Now, we go on to say, it's an interesting point. Another David said, if society doesn't help the destitute, is it not surprising that they turn to mind-changing medication? In other words, it's back to self-medication again.
I think he has a very valid point there. There's all sorts of issues about how you would define destitute. But what I would say is that one thing that we very clearly see is clustering of risk factors. So the risk factors of smoking, alcohol, overweight tend to cluster together. So we have about 11% of the population who have the full set of all those adverse risk factors. And we know that this goes with what we call inequalities in health. So the people that have those multiple risk factors are often the people in the poorest households. They are people who are unemployed. They are maybe people who have chronic mental health problems. And he's right, because their situations are dire, they may well turn to smoking, alcohol, drugs, eating as a way of giving themselves comfort and support, the self-medicating. So yes, we do need to think about how we reach out to those people. Right,
now we will call on our old friend now, Stephen. Good afternoon to you, Stephen.
Good afternoon, Roger, and good afternoon, Director. 2 issues, one for you and one for just general discussion. I was listening to your reply to David Quirk about the issue of Meals on Wheels, and I heard you speak earlier about the long-term effects of loneliness on people who are isolated and have difficulty making contact with others for all sorts of reasons. And I was a bit surprised when you said that you gave the reasons for the discontinuing of the Meals on Wheels contract with Age Concern. Now, the two, there seems to be a disconnect. On the one hand, you're saying loneliness is a big issue and is as bad as piling on with drink or cigarettes. And on the other, you seem to just dismiss the issue of Meals on Wheels as something that couldn't be resolved. Now, couldn't that have been resolved by discussion between yourselves and Age Concern to find a way forward where it suited your concerns and the way the Meals on Wheels are provided? Because you can't deny there's a lot of people in the community who, whilst they may be able to afford it, there will be a lot who can't. But the main thing about seeing somebody daily, or certainly in the week, Monday to Friday, is that social contact. And it seemed to me that you didn't present a logical reason for what you were doing to me. On the one hand, you dismissed it, and without any recourse to this issue of loneliness and isolation for older people.
I think we have to be very clear that the Meals on Wheels service was not funded by DHSC to provide social contact to people. And from a public health perspective, I would say that paying for people to have social contact is really not where we should be going as a society. We should be organising ourselves as a society to reach out and involve older people in the community and to provide them with befriending, not through the paid services provided by government. So I think we're conflating two different things here. Meals on Wheels was never intended to be a funded service to provide social contact to lonely people.
But with respect to your answer, surely to goodness it follows that keeping people in good health, and if that is one of the issues, which is keeping that daily contact, keeps them in good health, you've got the flip side of the coin, as if they fall into ill health, then you are going to have to fund the extra care of their ill health. Now, to me, I'm afraid I don't agree with your answer. I think it's too clinical. I just do not think you're accepting the human condition. I think there is a requirement and a responsibility on the state at times to provide these things.
However, you mean which department? You mean there's not the dividing line or drawing the line between departments? Is that what you're saying?
Black and white health never is.
Yes.
Anyway, I've heard the director's reply. I'll move on to my next point.
Just before I do that, Steve, what was the thoughts about that? I mean, if it wasn't the job of the department to do as you say, but it's quite clear that there's a need for it, and you say it should be done in another way, I mean, how soon is that going to happen? Where's the replacement facilities going to come from?
I'm sorry, I'm not following the question there.
Well, you said that it's not the job to provide with lonely people, provide contact or friendship and so on. It was a different issue. But it was providing it. So if you take it away now, what are you going to do about it?
We actually don't know that it was providing it. I mean, yes, it was providing somebody who went in and dropped off a meal. There were issues about the nutritional value of the meal. But I think the key point there is that, and it is a political issue. It depends on how you feel government should spend its money and what taxpayers should pay for that to be done. But my personal perspective is that it is not the role of government to provide friends for people. And it's also an issue about older people and how they function in society, which is not that they should be marginalised and government or someone else should pay for somebody to go in and talk to them for 5 minutes while they give them a sandwich. I don't think that's a quality of life for our older people, and I believe that very strongly. We want an active ageing population who are actually out there participating in society.
If they can.
If they can, and society should be reaching into them and befriending them to help those that can't. And we have some wonderful voluntary organisations that are already doing this kind of work on Ireland.
Right.
And that's what I think we should be building on.
Okay, well, let's move on to your second point. Stephen?
The second point, Roger, is again a political one, but it's one I want to comment upon, and that is the proposal from Alf Cannon and put forward by Chris Thomas to change the way the voting is for the Chief Minister. Now, the one thing I will agree with Chris Thomas is that people do want a change, and they were hoping for a change, and I think that change certainly is not the one that's coming forward, whereby there will be less people voting for the Chief Minister than previously. And this will mean that the Chief Minister could be elected by 13 people out of an island of 86,000. Now, for me, I don't think that's democracy in action. I do think there is an issue, but certainly reducing the numbers that vote for him is not the solution. And for me, I say back to the drawing board. Now, I think there's several issues here. We have had some ideas of electing MLCs. It's never been accepted because the Keys have thought they will become super politicians. The same for directly electing the Chief Minister. There's a feeling that they would become a presidential type figure and having all the votes in their hand. And out of all this, I just feel that reluctantly we've got probably the best way that we can now, and that is involving as many people in the process who comprise Tynwald. And I would hope that when the MHKs discuss this matter on Tuesday, they take these points on board. I do not believe this is a step forward for democracy. I think it's a step back.
Steve, thank you for joining us today. Cheerio, and a good Christmas to you. Right, there we are. We just had time for a break now. We'll be back in a couple of minutes. Welcome back to the last part of today's Man in Line. Dr. Henrietta Ewart, who's the Director of Public Health, is our studio guest here. And we've had a few phone calls and quite a few texts and emails. Some more here. Henrietta, the unopened suspicions of David Quirk concerning MHK Thomas's motion are like something from any questions, and I, for one, don't condone them, says Alva from South Maloo, spelt in a funny way. Right. Now, Ian doesn't agree with you too much, Henriette, here on your opinion on air quality. She says, what are we supposed to do? Never leave the house? The island has vehicles, yes, but the pollution in the air is hardly worth panicking over. You can't wrap the world in cotton wool.
Yep, no, I absolutely agree with you. And as I said when I commented on this before, even if you live in London, which is one of the worst pollutions in the world, you will still get a health benefit of exercising over and above that pollution. So I'm certainly not trying to create a problem that is not a huge one here, but I think our issue is that we don't even know what it does look like because we're not doing any measuring at the moment, and we need to do that, and we need to look particularly around vulnerable areas such as schools and, you know, the simple things like discouraging people from idling their engines, etc., that we could do, which would improve things.
Right, okay. Another David. We got a few Davids today. Come on here, but this is a different David. He says, why are so many hospital nurses obese? Physician, heal thyself.
Well, the hospital nurses, I think, reflect the prevalence in the population generally. So that's, 60-odd%. So you would expect a fair few of the nurses to be overweight, just as you would anyone else.
Well, you could argue, perhaps, that in their job they should know better.
They should, and this comes back to the fact that they almost undoubtedly do know the theory. It's putting it in practice. But actually, one thing that we are trying to work on through public health is improving the health of the DHSC workforce. But early days yet.
Now, Rob was talking about the phrase grim reading in your report earlier on, and I couldn't remember either of us using it. However, he says grim reading was the phrase used in Manx Tales article on your report, this recent edition, which I think is now known as Manx Life, but there we are, that's the... The caller said all these people who can't cook, I think it goes back to the schools. I left school in 1938, but we were taught to cook. We were also sent out with a certain amount of money and a list of things to buy to make it. So we were taught to cook and to shop. I think these days it's down to the schools that it isn't happening now.
Yeah, I think that's an area that we could certainly look at.
Michael Starkey says, hi there, you see it every day in most shops, piles of huge choc bars and biscuits if someone's tempted. So it's easy to pick up a bar at Marks and Spencer's and have dried fruit snacks at the checkout.
Absolutely.
So we keep complimenting them there. Well said, Steve. Total respect, lad. Total respect. We have a puppet on the radio today. A change will be made from Dave. Why, you have a puppet on the radio? I mean, who that is? Not where anybody's working our strings today, Dave. Now, what else have we got here? There's a very long letter which I'll come to in a moment if I get time, and there's that's a football thing which will be in the news. I think it's essential we provide a Meals on Wheels service. It's part of a caring society. So this comment is always running there, Henrietta, that they do think it serves a purpose. Are you closing the dental department at the Old Nobles and giving it to a private firm?
I have no idea. It's not within my department's remit.
Right. Dr. Ewart's reply to Steve Moore that government ought not to be concerning itself with providing social contact for people isn't correct. Looking at the Southern Befrienders annual report for 2014, it discloses a government grant to Southern Befrienders of £10,000 per annum.
Yes, that's a grant, and in fact we're looking at what we're doing with grants, so there are issues there, but I think that's a grant to encourage a body to do something, which is not the same as directly commissioning to say we want you to go in X times of day simply to befriend this person.
And my only form of heating is a coal fire, so do you want me to freeze? Well, I think that's a question that you don't need to answer to on that, right? So now, let's see, that's just knocking through some of the questions. A couple more and a couple of minutes to go, and now there's a very long letter, this one, so let me, my wife, Patrick is called, my wife and I have been on the housing list for a bungalow since 2008. She osteoarthritis and struggles to use the stairs. She's been rushed into hospital now because of her condition, but she's having to use the stairs for 10 years in her condition. You were talking earlier about obesity and people being overweight. My wife's put on weight because of her condition, and she hasn't smoked for 27 years, and she hasn't drunk alcohol for years since she put on medication. I'm her sole carer, and I've got a hernia, but I have to help her in and out of the bath, and I've got asthma. But nothing's been done about our housing situation for 10 years. So we haven't touched on this at all, but proper accommodation does come into the whole package of public health, doesn't it?
It does, but obviously housing is a separate department from ours, so I can't comment on housing allocation for individual cases.
You see, you're mentioning this, but this is what I was saying to you earlier on about when you talk about separate departments, separate responsibilities. It can be very frustrating for the average member of the public to hear this, that it's all pigeonholed and compartmentalised still. So do you think you stand a chance, going back to the terms of your report, of getting some of these barriers broken down?
I think we have to work away at them. I doubt that it's going to be a quick job, but we do have to try and make the changes.
Right, well, short answers because we have just over a minute left to go. And I have a very long letter here which I'd like to read, but it's going to take me 2 or 3 minutes to read it. So I'm sorry about that, Sammy. Maybe I'll ask Catherine to print it off and we can read it on another programme. Our studio guest today has been Dr. Henrietta Ewart. He's Director of Public Health. She was here for the Mannin Line, Sunday Opinion and the Mannin Line. She stayed on to answer some of your questions, mostly by texts and email. And thank you for doing so. I hope that your report registers. What's the next step?
We are doing some work in the new year with other government departments and local authorities and the voluntary sector to actually start to think how we might work together on some of these areas to start breaking down those silos.
If you want to look at the report, it's on the government website gov.im in public health. You will find it there. You can also ring up and ask for a copy at 01624, Alaman code 642639. Catherine Nicholl was on the switch. I've been your host today on today's Mannin Line. We'll be back in a fortnight's time on the 7th of January after Christmas and New Year. So until then, from all of us, we hope you have a very good Christmas, very good New Year, and goodbye.